Hi there, my name is Sarah and I'm here today with iHealthBrokers to give you an update on costs for Medicare in 2021. Today we'll be discussing Medicare Part C, also known as Medicare Advantage, and Medicare Part D, which is your prescription drug coverage. As you probably know, we're currently in the annual enrollment period, which is every year from October 15th to December 7th. All right, let's dive right in. Welcome to our channel. We release videos designed to educate and inform people about Medicare and health insurance in general, so please make sure to like this video and subscribe as well. We're constantly releasing videos designed to demystify health insurance and help you save some money. We're licensed health brokers, so if you have any questions, please feel free to just leave a comment below, or you can give us a call here at iHealthBrokers at 888-410-0344. There's absolutely no charge for our services. You're not pressured to buy anything. And if all we can do is answer a question, that's absolutely fine by us. Your health and your health insurance really is very, very important. But unfortunately, too many people are uninformed, which leads to poor choices in purchasing health insurance. This can lead to exorbitant bills or illnesses that are allowed to progress too far because people are afraid of those big upfront costs. So today we're going to be talking about the costs of Medicare Part C and Medicare Part D. Now, if you'd like a further dive into those topics, you can check out our other videos, which I'll put in the description below. Medicare Part C is also known as Medicare Advantage. It encapsulates the benefits of Medicare Part A, which is your hospital insurance, Medicare Part B, which is your outpatient insurance, and very often additional benefits as well. For example, many Medicare Part C plans offer prescription drug coverage or dental, vision, hearing, and wellness programs, amongst many others. Now, a lot of people find themselves choosing between a Medicare Advantage plan and a Medicare Supplement plan because they are similar in that they help to bridge those gaps of original Medicare and limit your out-of-pocket spending. However, there are some major differences, so it's really important to know which is right for you. Now, Medicare Advantage plans are offered by private carriers, and the benefits can vary widely. They can also change from year to year, especially those fringe benefits. So it's really important that you pick a plan that most closely matches your needs and that you review it every year to make sure that it's still the right plan for you. Something also really important with Medicare Advantage is that you have to make sure that your doctor and your hospital of choice accepts your specific Medicare Advantage plan, not just plain old Medicare. And sometimes you may find yourself having to travel to find a doctor or a hospital that accepts your plan, which is obviously not ideal. However, in some places, like Florida, Medicare Advantage reigns supreme, and it's really easy to find a doctor or a hospital that accepts your plan. So currently we're in the annual enrollment period for Medicare Advantage, and that's every year at the same time from October 15th to December 7th. Of course, you also have the option to enroll during your individual open enrollment period or a special enrollment period if you qualify. And if you want to learn more about that, just check out one of our other videos about Medicare Advantage or about enrollment periods. Medicare Part C, or Medicare Advantage, definitely offers the most diverse variety of plans. You can choose from HMOs, PPOs, MSAs, or even special needs plans like D-SNPs, which combine Medicaid and Medicare. You can check out our video all about that. Now, there are some costs that you need to be aware of regardless of which plan you choose. These would be things like premiums, deductibles, co-pays, and out-of-pocket maximums. So premiums are what you pay monthly to keep your insurance active. Some Medicare Advantage plans actually have no monthly premium. You just need to keep paying for Medicare Part B. Then there are deductibles. Deductibles are the amount that you must meet before your insurance kicks in. Some Medicare Advantage plans actually offer $0 deductibles. Then there are copays. Now, these obviously vary widely from carrier to carrier and plan to plan. It's the amount that you pay for a given service. Also, many Medicare Advantage plans offer prescription drug coverage, so those copays would come into play when purchasing your prescription drugs. Please make sure if you go with Medicare Part C that you do get one that has prescription drug coverage. And then finally, there's those out-of-pocket maximums, and they are just that. It's the max that you have to pay out of pocket. Sometimes you can get a plan that the out-of-pocket maximums are in the low thousands, but it can go as high as $10,000. So like I said, these plans really do vary widely from carrier to carrier and plan to plan. And because they vary so widely, it's really hard to give you hard data for the costs for 2021, but what I can tell you is this, that the trend for 2021 is that the costs are going down. Great news. Actually, since 2017, Medicare Advantage plans have gone down about 34%, and that's partly because they're roughly double the amount that there used to be. So more competition equals lower prices for you and better benefits. So if you're thinking about Medicare Advantage or maybe switching to a different Part C plan, you can call an agent, but please don't, because they're only going to give you their company, their carrier's plans, which is going to really limit your options. Or you can check out all the plans available on Medicare.gov, that's Medicare.gov. You can also call the website directly at 1-800-MEDICARE if technology is really just not your thing. And finally, you can contact a broker. Please contact a broker. It's going to make your life so much easier. Make sure they're licensed, of course. A broker will help you comparison shop from multiple different carriers, multiple different plans. Also, Medicare Advantage may sound great on paper because it's got all of those different benefits. However, if there's not a lot of doctors or hospitals in your area that accept your plan, it's not going to do you much good. Medicare Part D is your prescription drug coverage. Like Medicare Part C, it's offered by private carriers, but it's actually regulated by the federal government, so carriers can choose to offer better benefits, but they must meet federal guidelines. So there are 4 stages to Medicare Part D. There's the deductible, the initial period of coverage, the coverage gap, and catastrophic coverage. And each of these stages have limits or maxes, and those limits have gone up slightly from 2020 to 2021. In 2021, the federal government has set the max deductible at $445. That's a $10 increase from last year. You're responsible for all of those costs out of pocket until you meet that number, but it might be less dependent upon your carrier. Some carriers actually offer a $0 deductible. Once you meet that deductible, you'll be responsible for copays dependent upon your medications tier. This is the initial coverage period. Once you hit $4,130, you're going to move into the dreaded coverage gap, also known as the donut hole. This is an increase of $110 from 2020, but this is actually good news. It means that you will have more coverage before you enter the coverage gap. Now we're in the 3rd stage. This is the coverage gap. As I said, sometimes it's called the donut hole. During this time, you're going to pay a percentage of the drug's cost instead of a set copay. The percentages are holding steady from years prior, and your out-of-pocket costs are unfortunately most likely going to increase temporarily during this time until you hit $6,550. That's a $200 increase from 2020. However, there is good news. The premiums for Medicare Part D are way down, and like Medicare Part C, there are many more options to choose from, which makes it much easier to comparison shop, ensuring that you get better benefits at lower prices. During the annual enrollment period for Medicare Advantage and Medicare Part D, you can join a plan or drop a plan or switch a plan. And even if you're not new to Medicare, this really is something that you want to take advantage of, because currently the trend is for lower costs with better benefits. So it's highly likely that there's a better, newer plan out there that might be less expensive and better for your needs. Now, if you want to check out all your options, you can log on to Medicare.gov, that's Medicare.gov, or call 1-800-MEDICARE, or you can give us a call here at iHealthBrokers at 888-410-0344. Like I said, there's no charge for our services, no pressure to buy anything, but we will definitely make things a lot easier and less expensive. If you liked this video, make sure to click like and subscribe as well, and also hit that notifications button because we're going to be coming out with our Part 2 of Medicare Costs for 2021 shortly. If you have any questions, leave a note in the comments below, and we hope to see you soon. Thank you so much. Have a great day. Bye-bye.